Welcome back everyone to another video. Now this video is actually going to be a little bit different. You've all seen the training videos, but today I'm going to be focusing on recovery. And one of my favorite forms of recovery is dry needling or acupuncture. And we are currently here at Naperville Acupuncture Center. We're filming this inside because it is currently pitch black outside at 5 p.m. already. But yeah, we're currently inside Naperville Acupuncture Center. I'm going to go see my physical therapist, Frank, that I've been seeing for probably about 2 months now or so. I've been very impressed with his technique and what he does, how he does it. And so I talked to him, he said he'd be fine with filming a little video. So also big shout out to my friend David who's filming. But we're going to do a little video on dry needling, acupuncture, the differences. I'll have him explain the differences, and then I'll probably have him take me through a little bit of an assessment, show you guys what he does, what he thinks of me, and then of course the reason why you all are here, the treatment. So we'll try to get some needling on here, some footage of that, and yeah, we'll see how it goes. So let's get going. Oh wait, but before we do, I mean, come on guys, I'm getting needles stuck in me. The least you can do is hit that subscribe button. All right, let's go. And one of the great things about the Naperville Acupuncture Center is the receptionist, Angela here. Wonderful lady. Always fun to see her. But yeah, very friendly person. So if you're ever in the Chicagoland area, definitely check them out. I'll have their information in the description box below.
Raise his leg, 90 degrees is normative, and he's a little tight here. As this one comes up, the left leg's come along for the ride a little bit, and then we're going to bend the knee. We're going to check hip flexion, so that's also a little bit tight. And then internal rotation, it's okay. External rotation, so kind of tight all around the hip capsule here. And then we'll also check foot.
Take off my slippers.
Good idea. So these are available on Amazon. Okay, so dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. So real tight in plantar flexion, very tight in dorsiflexion. Okay, then we'll set this one down. And then straight leg raise here. 90 degrees is normal value, and again, a little tight. That right leg is starting to come along for the ride. Flex the knee. We'll check hip flexion here. Also a little tight in there. Okay. And then we're going to do a little muscle testing. Okay, so first we examine the range of motion, passive range of motion, and then we're going to test the muscles' relative strength from right to left. So first one is resisted abduction. So he's going to drive into abduction, which is moving the leg out to the right. So go ahead and resist. And that's okay. And then we'll try the left. So he's going to drive towards his left. That's not quite as good. So there's a little break on that. You feel the difference?
Yeah.
Okay, so then we're going to try resisted hip flexion to test the quadriceps as a hip flexor. So keep your knee here. You pull that way, I push this way. So that's fine. That's rarely a problem. Okay, and then we'll try the quad again as a, I'll stay there. We'll try the quad again as a knee flexor. So this time you push up, I push down. So usually this one is not as good. Much better on the right than on the left. Okay. So now we're going to do the adductor. So the adductor pulls the leg towards the center. So he's going to hold the foot up. I'm going to drive towards his right. He's going to push towards the center. And that one is good. Okay. You don't too often see a problem here either. Push in. Although
That one's weaker.
you see one here. So yeah, a little weak on the adductor on this side. So far we've got the adductor, the rectus femoris, the glute medius too, and then let's do the TFL. So the TFL is the tensor fascia lata. So we lift the leg about 45 degrees, internally rotate. I'm going to drive inwards and down. He's going to push outwards and up, and he's okay there. And then he's going to push out and up, and he's not great. Okay. I'm going to check the glutes. So we're going to flex the knee about 45 or 50 degrees. Elevate off the table. Hold it right here for me. I'm going to depress. You press back up. And glute on the right side is that's a little soft. Okay, and then here, lift this one up here off the table and push up hard. Pretty solid there. Okay. Which one was stronger, the right or the left?
My left.
Yeah. So let's go ahead and I think we'll start working on the left hip. And the back is nice in the line. So anybody watching this, this is a good way to sleep. This keeps your back from torquing. That's torquing, and then we're going to go ahead and treat his left hip complex, okay? So.
And what is the difference between dry needling and acupuncture?
Okay, so a lot of people ask me, what's the difference between dry needling and acupuncture? And the difference is acupuncture, as we understand it, acupuncture, acu is a Latin term, it means needle. Puncture is an English term, it means puncture. So acupuncture means needle puncture. So the question is, if you are puncturing with needle, why are you doing what you're doing and how are you thinking about what you're doing? So in other words, we have traditional Chinese acupuncture. Traditional Chinese acupuncture is given based on the traditional understanding of what they call the meridians, the energy flow, so on and so forth. That is the traditional acupuncture. Dry needling is using the same type of needle, but the theory is based on understanding of the anatomy, primarily the muscular anatomy. So in dry needling, what you're looking for is a muscle, basically a muscle contracts, relaxes. Sometimes through overuse, it will contract and have a difficult time relaxing. Okay, the muscle gets kind of stuck. And when the muscle gets sort of stuck like that, it puts pressure on the blood vessels, it puts pressure on the nerves, it makes it difficult for blood to circulate into and out of the tissue, and that is the formation of what they call the trigger point. So the muscle becomes tight, short, it becomes metabolically challenged because the circulation is impeded, and needling that dissipates that tension, okay? So needling, when you're needling into the muscle, with the dry needling concept, you're looking for what's called the trigger point, the muscular knot. When you contact that, the muscle will fasciculate, okay? It will contract and then it will relax, okay? It will contract fully and then relax completely. So that's the theory of dry needling. You needle the tight muscle, it contracts, relaxes. When it relaxes, it takes pressure off the blood vessels, it takes pressure off the nerves. The tissue can become restored because it starts getting circulation. So that's the theory of dry needling. Now,
so for athletes, what's the benefit there? What's the advantage of dry needling?
So the advantage is very often when you're training athletically, even if you're doing it as correctly as possible, you will overtrain, you will overuse the muscle. The way you develop muscular tightness is through overuse, inefficient use of the muscle, poor posture, sometimes injury, okay? Sometimes overloading the muscle is going to cause it to tighten up because your body wants you to stop doing whatever you've done to create that problem. So a lot of times when somebody they lift something too heavy and their back goes into a spasm, that's a case of what's called a myotatic reflex. The muscle has basically locked itself down, and that can be restored very quickly, and that's where you get a good reputation for dry needling. We are actually going to do something similar, but slightly different. Okay, what we're going to do is called motor point needling. So motor point needling is yet another type of acupuncture, and the difference is we will do some dry needling too, but motor point involves some electricity. Okay, so that just potentiates what we're doing. And when we did our initial evaluation, we noticed some weakness in the hip abductors, the TFL, the quads, so on and so forth. When we stimulate the motor point, we can expect that when we retest the muscle, it will actually have more power. It will actually be stronger. Then when he goes out and he does his training, he will be able to integrate that newfound strength and develop a better pattern. So we'll talk more about this as we go on, but let's get into some needling now. Okay, so before we start, we're going to reveal his lateral and posterior hip here. So this is the top of the pelvis. Here is the tensor fascia lata. So this is the ASIS, this is the anterior superior iliac spine. The tensor fascia lata comes from the ASIS and runs into the IT band and then terminates at the fibular head. So the tensor fascia lata, this is a hip flexor and an internal rotator. So now we're going to talk a little bit about our premise of needling. When somebody is moving improperly or overloading a certain muscle, that muscle will fatigue and an accessory muscle will pick up the slack. So a lot of times this is going to be the TFL. And so we're going to go ahead and treat that. Over here, we're going to find the gluteus medius, or gluteus minimus rather. So this is not a complete muscle, but it's going to be in this zone here. So this is a hip abductor and external rotator. So we're going to go ahead and I'm going to go right to about the center of the muscle here. I'm going to insert it probably 5 to 10 millimeters. And we're going to give it a little bit of electrical stimulation. So we're going to go ahead. All right, here's the fun. There it is. Okay, down here. There we go. All right, so that is how you do a motor point. And so the purpose of the motor point is to restore the length of the muscle, restore the proper length tension of the muscle. So now we're going to do the gluteus medius, which is found in between the TFL and the gluteus minimus. This is a hip abductor. Okay, this lifts the leg to the side. And this muscle is important in gait stability. So when you're running, this has to activate. Okay, one more. So now we're going to do the rectus femoris. Okay, so the rectus femoris is the main knee extensor of the quadriceps. Yeah, so go ahead and, so he's got a good one, obviously. He trains, you can see it. So we're going to go, you can relax here, from the ASIS again to the greater trochanter, about a third of the way down. It's going to be the rectus femoris motor point. So again, I want to restore muscle tone. So you may ask, why use the motor point instead of the dry needling? The dry needling I use more for tightness, restriction, for when I see inhibition, when I see muscles not as strong on one side as compared to the other, then I want to use the motor point. Then I want to create more stimulation. Okay, so we should probably talk about inhibition too. We didn't get quite the right location, so sometimes you got to re-angle it.
Oh yeah.
Much bigger difference. So if you get this just right, let's try it right there. There we go. Okay, so let's try that. There you go. So you can see this goes all the way down to the knee. So this is a good contraction. Perfect. Yeah.
Oh.
Okay, so now we're getting the femoral nerve involved a little. That's good. So there we go.
That was a big one.
Okay, so as it's practiced in physical therapy, primarily is concerned with treating the tight ropey bands, the trigger points. And I do that, and that's part of what I do, but I'm also concerned with treating motor points, which is where the nerve is plugged into the muscle, because when a muscle is overused or injured, it becomes inhibited, meaning that the ability of it to contract fully is reduced. And that inhibition is what leads to a dysfunction, which leads to compensation, which leads to improper motor patterns, and that's the beginning of chronic problems. So the idea is, if you can assess the person, find the weaknesses, treat the motor points, restore the inhibition, facilitate the muscle, then they can go back out and train, and they will be able to remove that dysfunction. So sometimes you may need PT or coaching or personal training or something of that nature to help you correct your exercise, to cue you. But in terms of restoring the muscle tone immediately, this is the thing. So I think we've got everything we wanted on this side here. So yeah, that big toe mobility is a whole other issue. And since we did see a little tightness in the plantar flexion, we'll get the calves today too real fast, okay? So now we're gonna go ahead and do the infamous IT band, which a lot of people have issues with. And as we know, the IT band really is not a muscle. Really when we're needling, we're really needling what's called the vastus lateralis, which is one of the quadricep muscles. It goes from the, I believe it's the lateral part of the lateral linea aspera of the femur, and inserts at the patellar tendon. And it is also a knee extensor, but it has a little bit of a external rotation aspect to it. But you know, as far as knee problems go, the patella is, when we have patellar tracking issues, it's because on one hand you have the vastus lateralis, on the other side you have the vastus medialis oblique, the VMO, and these two are basically pulling back and forth against the knee, the patella. And as the person is running, this one tends to overpower this one. So a lot of times we'll release this one, but we actually want to stimulate this one. So we want to strengthen this side and reduce tension on this side. So this again is not just about killing the pain. It's not just saying, well, we've got a sore spot, let's stick a needle in it. This is about thinking about where are the muscles imbalanced and how we can restore that. So let's go ahead. It's enough preamble. Let's go and do the there. So he felt that. There, right there. There. So anyhow, the IT band itself, the iliotibial tract, is not a muscle. It's a tendinous sheath formed there. Okay, we've got a good one. Good call. There we go. It's a tendinous sheath formed by the aforementioned tensor fascia lata, and the fibers of the gluteus maximus come together in a Y shape to form a sling. So it stores a lot of mechanical energy, but it's not a muscle in and of itself. And so, you know, foam rolling it, I don't know. Do you think it's productive? I don't think it's that productive at all. Now, just for fun, we'll add the motor point, and we'll see the difference that...
and where are we looking for that activation to occur?
Probably the whole side here. Let's see. Not quite. There you go. So that's the difference of using the stim. We get much bigger contraction. See that?
Yeah.
This is personally why I prefer this, because with one needle we're activating a whole big area, and you can even get into needling the nerve trunks directly. So as we were getting on the quad on the other side, I was actually getting the femoral nerve, and the femoral nerve is not just the single muscle. It's getting all the muscles of the quad and even into the lower leg there. So we said we were going to do the calves real fast, and then before we do that, since we got you face up, foot up here, and let's test his abduction. So push out to the side, push up. So that, okay, I'm pushing and he's not moving, so that's good, okay? And let's try the rectus femoris. So you drive towards the ceiling, I push down, push up hard. So that, it's better than previous, but still not as good as the other side. So it improves some. And now the TFL, push out. So that's
a lot better.
Yeah, that's toned up. Yeah. So you can tell the difference. The patient will feel it, and the operator will feel it also. Yeah. Okay, so I think we'll just go ahead and do the calf muscles. Okay. Let's go ahead and face them down. A lot of people are restricted in their dorsiflexion, and so we got a good, there we go, we can see that there. There we go. So that's just a regular dry needle. So with dorsiflexion, you can get a good, with releasing the calves, you can increase dorsiflexion. And if you don't have good motion of the foot on the ankle, that's how you get into having plantar fasciitis, heel spurs, and things of this nature. So the foot has got to be able to move on the ankle, okay? And a lot of people have a restriction there. So there we go. So you saw this little Ironman move. There it goes. There it goes. Okay. There we go. Okay, so that's that. And now we'll show you the gua sha technique real quick. Here is the classical tool. It's jade, okay? So jade in Chinese medicine is considered to be a healing stone, and this is just a, beveled edge, and you just hold it in your hand, and you just, gua sha means scraping, basically, in Chinese. And so this is kind of the antecedent. This is the forerunner of the Graston technique. You want to do a little soft tissue follow-up, okay? Because basically you want to remove any inflammatory compounds from the tissue. And the soft tissue also helps the proprioception, and it feels good. It helps the person feel better. So this is a little bit heavier duty. Active release technique, you can go opposite the direction of the muscle. As far as the acupuncture / dry needling / motor needling, so I encourage people, these are just words. These are artificial separations. The bigger thing is to understand what the needle does, why you're doing it, and what your intention for the outcome is going to be. So it doesn't matter, PT, acupuncture, chiropractor, anyone that trains in this and is dedicated, they're going to be good at it, okay?
Well, there you guys go. That's what a typical dry needling, acupuncture, motor point, trigger point, all the above session looks like. David, what do you think?
It was cool, man. It was a lot more targeted, a lot more feedback with the client, with you, than just kind of, hey, let's throw a bunch of needles and see what happens. So really kind of cool to see the depth of knowledge and how it was really detailed into you, your specific responses to tension to the testing we did before and after. So
yeah,
really cool to see.
As I mentioned, Naperville Acupuncture, I'll have their information in the description box. Check them out. Tell them I sent you. And we'll see you next time.
We'll see you in the next one.